California wants to ban doctors from spreading COVID misinformation. But is this helping science? Welcome to America Uncovered. I'm Chris Chappell. So, it's 2022. The COVID pandemic is old news. While the rest of the U.S. seems to be settling into a bored coexistence with COVID-19, California is worrying about COVID misinformation. Do you hear that? It's the sound of this episode being demonetized by YouTube. Yes, California is trying to make it illegal for doctors to spread COVID-19, quote, misinformation. Last week, the California legislature passed a bill called AB 2098. It was first proposed in February of this year by a group of state lawmakers who formed California's Vaccine Work Group. This was one of many other COVID-related bills the group proposed, but none of the other bills made it through the California legislature. Yes, making it illegal for doctors to spread misinformation was the least contentious bill. The other ones included things like requiring all school children to be vaccinated, or requiring all employees and independent contractors to show proof of vaccination, or requiring the police to enforce public health orders. It's nice to know that some things are too much even for California. So what about the bill that did pass? Well, it begins by saying major news outlets have reported that some of the most dangerous propagators of inaccurate information regarding the COVID-19 vaccines are licensed healthcare professionals. And as we all know, major news outlets are always accurate. According to the bill, misinformation or disinformation includes anything containing false or misleading information regarding the nature and risks of the virus, its prevention and treatment, and the development, safety, and effectiveness of COVID-19 vaccines. The bill doesn't specifically say what counts as false or misleading information, nor does it make it clear who gets to decide that. But misinformation is defined in the bill as anything that is contradicted by contemporary scientific consensus, contrary to the standard of care. Remember that term, scientific consensus. I'll come back to that later. According to the bill, spreading what is considered misinformation or disinformation will be considered unprofessional conduct. This could have devastating consequences for California doctors. Technically, the legislation wouldn't make doctors lose their license as punishment for unprofessional conduct. It leaves that up to the Medical Board of California to do that instead. Gotta love it when the government uses indirect means to get what it wants. Assemblymember Evan Lowe, who introduced the bill, says California medical boards will be given the tools necessary to bring discipline actions against a licensee. What kind of tools? Well, we took a look at the medical board's disciplinary guidelines, and the minimum penalty for unprofessional conduct is 5 years of probation. The maximum penalty is revoking the doctor's license. But it seems like the bill gives the Federation of State Medical Boards, or the FSMB, sharper teeth to do what it wanted to do anyway, at least in California. See, way back in July of 2021, the FSMB released a statement where it threatened that spreading COVID-19 vaccine misinformation might put a doctor's medical license at risk. In the statement, the FSMB said, due to their specialized knowledge and training, licensed physicians possess a high degree of public trust and therefore have a powerful platform in society whether they recognize it or not. AB 2098 specifically mentions the FSMB statement. And Lowe had this to say about the bill. Due to their specialized knowledge and training, licensed physicians possess a high degree of public trust and therefore must be held to account. This is like that time you needed to turn in a school paper at the last minute and you knew you shouldn't plagiarize, so you just changed the last part of each sentence you copied from Wikipedia. Okay, who's really pulling the strings here? The California legislature or the Federation of State Medical Boards? One thing that's important to make clear about this bill, it only applies to what a doctor directly communicates with their own patient. It doesn't deal with comments a doctor might make, for example, on social media. That used to be in the bill, but it was taken out. If the misinformation bill gets signed by Governor Gavin Newsom, California will be the first state to have this policy. But lawmakers in at least 14 states are doing the exact opposite of what California is doing by pushing back on medical board misinformation stances. Seriously, who's in charge here? The states or the medical boards? A lot of those bills are designed to protect doctors who prescribe off-label drugs for COVID treatment, like ivermectin. Basically prevent medical boards from disciplining doctors. And most of these bills have only been proposed, not approved. Meanwhile, many in the medical industry are supporting the California misinformation bill. Some medical experts say misinformation has worsened the impact of the pandemic, resulting in thousands of unnecessary hospitalizations and deaths. And they think licensing boards should do more to discipline doctors who share false claims.
There are a number of doctors willing to betray their oath, politicize, and weaponize their white coats for political and/or financial gain, metastasized throughout our nation. This well-coordinated and well-funded network of doctors promoted anti-vaccine conspiracy theories, sowed distrust in the Centers for Disease Control and Prevention, the federal government, and ultimately the COVID-19 vaccines.
Yes, clearly Americans only distrust the federal government because of doctors. The California Medical Association president says AB 2098 will help preserve the integrity of the medical profession. But this raises a lot of issues. I'll explain after the break to just black nothingness. Welcome back from the void. California lawmakers have passed AB 2098, which allows the state medical board to punish doctors who spread COVID misinformation. But there are clearly a lot of problems with this. For one, it raises concerns about violating the First Amendment right to free speech. Should the government step in and enable medical boards to police what doctors say in the name of safety? Some say yes. Supporters argue that the bill is narrow enough to protect free speech. Remember, it only applies to what doctors communicate to their own patients. State Senator Richard Pan, a co-author of the bill, said the law was intended to address only the most egregious cases of deliberately misleading patients. Others, like the doctors in No License for Disinformation, say the bill will not have a chilling effect on free speech, as there is no evidence COVID vaccines contain microchips or have killed more people than COVID. So it's only free speech if there's evidence to support it? If that were true, it would have a chilling effect on about 99% of speech on social media. But the issue isn't about spreading information that vaccines contain microchips or kill more people than COVID. It's easy to look at extreme examples and go, well, of course people shouldn't say that. But then there's the bigger issue of who gets to determine what's truth and what's misinformation. Is that the government or medical boards? That's why a group called Physicians for Informed Consent is suing the Medical Board of California on First Amendment grounds. They argued that the medical board has weaponized the phrase misinformation to unconstitutionally target dissenting physicians who publicly disagree with the government's ever-evolving, erratic, and contradictory public health COVID-19 edicts. There have been a lot of changing and contradictory COVID advice and very public mistakes. From the beginning, the CDC bungled COVID testing. Public health officials have also flip-flopped on wearing masks. The same goes for lockdowns. Right before the pandemic, scientists told us not to lock down. But governments went with lockdowns anyway. Many said that lockdowns saved lives and slowed the spread of COVID. But as more transmissible variants have popped up, COVID's still spreading. Most countries have realized how useless lockdowns are and learned how to live with it. Except China, of course. The Chinese Communist Party is an expert at doing the most useless things in the name of safety. Then there's vaccines. Thanks to the new variants, vaccines haven't been reducing COVID case counts that much, unlike what health officials said would happen early in the pandemic. So what's the result of all of the changing advice? Well, multiple polls show people have lost trust in the CDC and public health officials. People have accused the CDC of being politicized, like when they relaxed masking requirements right before Biden's State of the Union address. The CDC has gotten accused of that by both the right and the left. Is this the government agency that determines the scientific consensus? The response to COVID-19 should be more than enough evidence that the scientific consensus is constantly changing, especially when dealing with a new disease. We shouldn't be treating current consensus as an unchallengeable truth. The scientific process should allow knowledge to grow based on continued questioning, observation, and experimentation. This can lead to better science and better solutions. In fact, historically, it has often been a single-voice challenging consensus that moves science forward. For example, in 1854, London physician John Snow discovered that cholera spreads through contaminated water. This challenged the medical establishment's idea that the disease spreads through bad smells in the air, and led directly to the idea that diseases are spread by germs. Limiting doctors to only share consensus-driven medical information is the exact opposite of science. Yet California wants to silence dissent on COVID-19. Should the government and medical boards have the power to determine what's true and what's misinformation? What if people end up getting punished for telling the truth? According to the litigator for Physicians for Informed Consent, the medical board's standard for misinformation is so hopelessly vague, it is impossible for him to advise his clients. Sounds like things are going well. So what do you think? Should states be passing bills that ban doctors from spreading misinformation? Leave your comments below. And if you like this show, remember that we rely mainly on direct support from viewers like you. You can either support us on patreon.com/AmericaUncovered or on our exclusive social media community on Locals at americauncovered.locals.com. Become a supporter and help us keep making great episodes. Click the link below. Once again, I'm Chris Chappell. Thanks for watching America Uncovered.